We have focused on frail and elderly, and we've used that as our focus with the NHS IQ team. Our demographic is older than the national average, and it's getting larger faster than elsewhere. Over the last 12 months, we've continued to see an increase in admissions for over 65s and over 75s to our hospital. So as we've been running this programme, the actual issues we're trying to deal with have actually been worsening. Our alliance has pulled together staff from the CCG, staff from the acute hospital, community services, the council, Yorkshire and Humber Commissioning Support, our mental health provider, and we had Health Watch working with us as well as the voluntary action at North Lincolnshire, Age UK locally, and North Lincolnshire Homes. What we had done in autumn 2013 was a piece of work where we actually went out and engaged with our community, and we actually went out with the question of what would help you keep well and maintain your independence. What people were telling us was that the key things that they wanted was support to pursue what they wanted to achieve. They wanted to feel safe. They wanted sort of to be have that trusted support and didn't need to feel like they were just being passed around the system. That vision we took into the programme and confirmed. Very first session around shared purpose. Those of you have probably all done something similar, tried to create some pictures. This was very much about actually a couple being able to live in their retirement in one of our small villages and being really empowered and supported to do that. And that's just another pictorial of the vision in terms of that, which gets referred to locally as the champagne glass. So we're trying to keep everybody in the bowl of the glass and kept well, but we've got the foundation of support where that's needed. In terms of its impact, there's a number of things we've done as a result of this. By having those range of partners in the room, there were some different conversations happening. One of the things that really came through was, I think, building on the Plan, Do, Study, Act sort of principles, was actually, can we just have a go at doing some of this stuff? But we didn't start small scale. We actually trialled 2 perfect weeks. The first one, 3 weeks from having the decision in the workshop that we were going to go for it, we ran it. And that was across 4 services. We're therefore being able to capture some of the learning from that in actually then designing it in more detail as we go forward. So that's really helped galvanise our approach. That was the big difference. Having run those weeks and being able to capture that really helped us get that approved. We're targeting a massive reduction in non-elective admissions. Now, part of that is if you actually compare us back to baseline, it's about 3.5%. But actually, because of that growth we've seen in year, it looks a lot bigger number. But actually, some of that's about correcting what's been happening that we don't want to happen. I think to an extent, one of the struggles we've had is spending a lot of time trying to really make sure everybody understands the problem and not doing anything about fixing it. So we've actually, to an extent, been pushed ourselves through this to take a bit of a leap of faith and say, well, we understand so much, but actually we're just gonna go with saying, well, if we do it like this, what would that look like and what would that do? And I would say one of the things we've got through this programme is a collective. Let's just have a go at this. Obviously with the safety nets around it, but let's just sort of not spend 2 years planning. Let's spend 3 weeks having a go at it and then learning from that, and it will evolve and emerge. This is the sort of changes that we're looking to put in place. They are very different to what they would have been when we started the programme. Some of that's been about the conversations we've had, some of that's been about the world moving on and the policy moving on, but a focus on prevention, a focus about working differently out of hospital and stopping people coming in, and then a change of focus about how we operate in hospital so that we actually dedicate a frail and elderly service rather than trying to deal with the elderly within the very busy environments. benefits for us and the relationship bit, we all come together, but we tend to come together for one or, we might come around a board table, we might come together around one workshop, but actually a series of 6 workshops that actually had broadly the same people in the room, people connecting who had never connected before. The tools and techniques really helpful in terms of learning, but more importantly for us was actually using them to make a change as opposed to just learning about it. I think one of the big things for me was that they actually gave us a safe environment to have the conversations and forget which organisation you're working for, forget what constraints you're under, think differently about if this is the outcomes we're trying to achieve for our population, what would it take? Individuals' feedback is that they felt they got a lot of learning and individual development out of it. I think the fact that we gave ourselves permission to try that led to say the perfect week, or near perfect week as some called it. We came up with some different ideas. That's about bringing a range of services together to work differently in that sort of crisis response. Relationships have definitely improved. The pace of discussions, and we're meeting again in a few weeks and we've got to have done something. I think it's been a really good experience for us locally, and I think one of the real challenges going forward is I don't feel this is something we can just replicate and run again on similar programmes, although a number of us can start to feed in. Actually, it's how do you build that knowledge across the system.